Sudden infant death syndrome, or SIDS, is the sudden unpredictable death of an infant under 1 year of age with no detectable cause after a thorough case investigation, including a complete autopsy, examination of the death scene, and review of the clinical history. The peak age for SIDS is 2 to 4 months of age. It is now believed that babies who die of SIDS are born with one or more conditions that make them especially vulnerable to stresses that normally affect the life of an infant, including both internal and external influences. SIDS occurs in all types of families, regardless of race or socioeconomic level. A SIDS death is rapid and is associated with sleep. There are no overt signs of suffering. More deaths are reported in the fall and winter, and SIDS affects boys more than girls. A death is diagnosed as SIDS only after all other alternatives have been eliminated, making SIDS a diagnosis of exclusion. The mother's health and behavior during pregnancy and the baby's health before birth seem to influence the occurrence of SIDS, but these variables are not reliable predictors for how, when, why, or if SIDS will occur. Maternal risk factors include cigarette smoking during pregnancy, maternal age less than 20 years, 2 or more SIDS victims in the family, poor prenatal care, low weight gain, anemia, use of illegal drugs, and a history of sexually transmitted disease or urinary tract infection. These factors, which are often subtle and undetected, suggest that SIDS is somehow associated with a harmful prenatal environment. The infant risk factors include prematurity, being small for gestational age, intrauterine drug exposure, central hypoventilation, or apnea of prematurity persisting greater than 45 weeks post-conception, twin gestation, and bronchopulmonary dysplasia. The environmental factors include crowded living conditions, impoverished home surroundings, prone position while asleep, use of soft pillows, comforters, sheepskin, or moldable sleep surfaces, and the winter months. How many babies die from SIDS? The good news is that it is declining. According to the National Center for Health Statistics, each year from 1983 to 1991, the number of SIDS deaths reported in the United States ranged from 5,000 to 6,000. In April of 1992, the American Academy of Pediatrics announced that healthy infants should sleep on their back to reduce the risk of SIDS, and beginning in that year, SIDS deaths began to decline somewhat. In June of 1994, the Back to Sleep campaign was launched, and SIDS deaths have continued to decline. The final figures for SIDS deaths in 1999 were approximately half of what they were in 1991. Most professionals attribute the significant decline in SIDS deaths starting in the mid-1990s to results achieved from health messages promoted in the public health campaign known as the Back to Sleep campaign. However, SIDS remains the leading cause of deaths in infants between 1 month and 1 year of age, and the third leading cause of death in infants from birth to 1 year of age, after congenital abnormalities and prematurity or low birth weight. So just how is SIDS diagnosed? As we discussed, SIDS is a diagnosis of exclusion. Often the cause of an infant death can be determined only through a process of collecting information, conducting sometimes complex forensic tests and procedures, and talking with parents and physicians. When a death is sudden and unexplained, investigators, including medical examiners and coroners, use the special expertise of forensic medicine, which is the application of medical knowledge to legal issues. SIDS is no exception. Health professionals make use of 3 avenues of investigation in determining a SIDS death. The autopsy. It provides anatomical evidence through microscopic examination of tissue samples and vital organs. Important because SIDS is a diagnosis of exclusion. A definitive diagnosis cannot be made without a thorough post-mortem examination that fails to point to any other possible cause of death. Findings on autopsy consistent with SIDS include slight respiratory infection or otitis media, blood-tinged froth from the nose, indicating pulmonary edema, blood-tinged emesis, indicating GI bleeding, a thorough death scene investigation. This involves interviewing the parents, other caregivers, and family members, collecting items from the death scene, and evaluating that information. This may be difficult for the family, but it is important, as a detailed scene investigation may shed light on the cause, sometimes revealing a recognizable and possibly preventable cause of death. Review the victim and family case history. Information about the victim's or family's history of previous illnesses, accidents, or behavior may further substantiate what is detected in the autopsy or during the death scene investigation. The nursing care concerns for SIDS focuses on prevention. That's parent teaching related to appropriate positioning of the infant, appropriate sleep surfaces and coverings, promotion of breastfeeding, and any environmental risk factors to correct or avoid. Care also includes emotional support to families. The loss of a child from SIDS is a crisis situation with a sudden, unexplained, and unexpected death. A compassionate and sensitive approach to the family at all stages of the situation is essential. It is important to allow the family time to hold and be with the infant to say goodbye. Arrange for someone to help take the parents home, if possible. Follow-up care is also very important. Offer referrals to support groups or other families who have lost a child to SIDS.